and I.
Resolution number 56424, resolution authorizing a grant agreement with the National African American Male Wellness Agency to support the African American wellness educational initiatives and events in the amount of $450,000.
Good morning. Good morning, Commissioners and County Administration. Damika Withers, Chief Economic Equity and Inclusion Officer in the Office of Diversity, Equity, and Inclusion. The mission of the African American Male Wellness Agency is to increase the life expectancy of African American men in physical health, mental health, financial health, fatherhood, and research. The African American Male Wellness Agency seeks to improve health outcomes affecting African American men who live across Franklin County and surrounding communities by engaging African American men and their families. The African American Male Wellness Agency contributes significantly to improving the overall health and well-being of Franklin County residents through their year-round health awareness initiatives. This grant agreement will cover the Real Men, Real Talk conference being held next Thursday on July 18th, Cooking with Dads, and the HIV Awareness Day. The African American Male Wellness Agency supports the importance of their parental relationship and offer programming that encourages the parent-child relationship as well as addresses the mental wellness of African American men. The Real Men, Real Talk program will host monthly conversations that will provide services to 400 African American men over a 12-month period, focusing on mental health and opioid addiction with a collaborative approach with local faith-based organizations, barbers, mental health specialists, and drug counselors. This resolution supports the Rise Together Poverty Blueprint Goal Number 9, reducing the overall incidence and racial disparities in occurrences of preventable diseases and trauma, and improving the health of those living with chronic mental, physical, and behavioral health conditions among those struggling financially. Here with me today is founder John Gregory of the National African American Male Wellness Agency, President Kenny Hampton, Senior Vice President Perry Gregory, Jonathan Bentley is back there, and other representatives from the African American Male Wellness Agency.
Good morning, Commissioner Carley. Good morning, Commissioner Boyce. Good morning, Commissioner O'Grady. And good morning, administration. It's an honor to be here again to have an opportunity to celebrate the partnership that we have in place. Mr. Gregory and I, we have the pleasure of traveling all over this country. And what I will say, he and I had a conversation this morning, and we wanted to really just highlight the fact that we do have the best commissioners in the entire country. The work that we're able to do here in this county, across this county with this partnership is truly the model. We've been able to partner with you. We've been able to go out into the community and provide impact to holistically support African American men and their families and some of the things that were just listed. And so every year we have an opportunity to celebrate and to honor individuals who are working very closely with us in this work. Back in 2022, we had Commissioner Boyce serve as our honorary chair for our Black Men's Wellness Day, known as the Walk. We also had in 2023, Commissioner Carley serve as our Uplift Her honorary chair, our women's initiative. 2024, we've been able to celebrate and just recently had an incredible event where our 2024 Uplift Her honorary chair, DCA Bivens, was able to help us provide screenings for hundreds of women. Thousands of folks came out for that event. But this year, we're excited because we get an opportunity to celebrate and to honor Commissioner John O'Grady and to officially introduce you as one of our health heroes for 2024 with the African American Male Wellness Agency. There were some comments that you made several months ago when we were here that really stuck out to us, and it did not fall on deaf ears. But you said, you know what? You know, I'm a white man, and I don't really know a whole lot about the things that, you know, is plaguing the community, but I'm going to do my part. And so we can't thank you enough on behalf of the entire organization for the work that you're doing, a part of the most impactful and the best Board of Commissioners in this entire county. And our founder, Mr. John Gregory. World. You know what? Yes. I stand corrected. World. In the world. Yes. But at this time, I would like to introduce our CEO and president of the National Center for Urban Solutions, Mr. John Gregory.
Thanks, Commissioner Grady. We, as a big committee, got together and said, who deserves this? And we all said that, this fight would not be won unless all of us collectively do this together. And so it doesn't matter whether you're black or white, it matters where your heart is. And we know where your heart is at. Your heart is in helping the black community rise to the occasion. So we thank you. I'm also standing here to talk about Real Men, Real Talk. What you will see is that black young men between the ages of 16 to 24 has the highest incidence of suicide. Black men over the age of 40 have the highest incidences of overdose of opiates. We just met with the coroner's office and had a long conversation with the coroner. This data is not from me, this is from the coroner. And what we know is that the incidence of black young men and black men committing suicide is extremely high. We know that our own personal experience over the last 90 days, we've probably known 4 young black men who have committed suicide. And so, but we also know that talk therapy is really great. And so before I go on, I do have Mr. Nguyen, who is here with us, who can tell you about his experience in participating in our Real Men, Real Talk.
Thank you, Mr. Gregory. To the Board of Commissioners and the administration for the Franklin County. My name is Roderick Nguyen. I moved here about 4 years ago. It'll be 4 years this November, my wife and I. And I met Mr. Gregory locally, and he invited me to come out to this Real Men, Real Talk. So I'm originally born and raised in Michigan, Flint, Michigan, and we moved here. And I met Mr. Gregory and some of his staff, and I went to the first meeting, and I was blown away because I've never seen a platform where men of color, and not only men of color, but men in general in that community can come together and have a conversation about not having a father, about living with a drug-addicted mom or a parent, living in a disparaged place, and they come together and they give them an opportunity to actually have a conversation. They don't present anything else to them, just have a conversation. And many that struggle for us, especially black men, to be able to express their feelings and their emotions. Mr. Grady and his staff, Mr. Gregory and his staff has allowed them to come into a place and not judge them, but allow them to have an opportunity to speak and to share. And some of the statistics that we know, when I moved here, I kind of looked at to see what Franklin County was about, and I seen that, out of every 100,000 residents, 166 of them are headed to incarceration. Many of those youth are stuck in Circleville right now. And I'm working with him to do that. And out of that particular meeting with Real Men, Real Talk, we have birthed a program which is called Brother to Brother. And in that, we're also going into the prison ministry because Mr. Gregory has opened up our understanding to see. And when we celebrated 20 years of African American wellness on last year, I've never seen it in such a way. And so my 2 cents to this is this. It's not really how you change an individual, but it's how you make that individual feel valued. And so hopefully I'll be going into Circleville at the end of this month. But Real Men, Real Talk coming up is always an opportunity, and it is across this country that they're making that available to youth in this community, in every community worldwide. So thank you for the opportunity, Mr. Gregory, for standing with you and partnering with you and your staff, and I look forward to many years to come.
So we will be going into Whitehall, Reynoldsburg. We're also going to be going into the county jails, start Real Men, Real Talk there. So the funding that you give us, really it goes directly into having impact in our communities. And how do we get these guys to come? Well, we pass out cards, we knock on doors, we go to churches, we go to barbershops, we go to basketball courts, we go to bars, and we talk to men. And you would not believe the number of men that show up and really just open up and talk. And actually, I was at the barbershop the other day. I do go to the barbershop even though I don't have hair. A woman came up to me and she said, Mr. Gregory, I just want to tell you that my husband does nothing. He doesn't go nowhere. He said, that Real Men, Real Talk, he does not miss a day of going and participate. We have a social media page. It's a closed page where men can come in and log in and have conversations. You will be glad to know that next week, Eric Robeson, R&B singer, has a song out. This year our campaign was Mask Off. R&B singer Eric Rosen has created a song called Mask, and he is going to put that song into full production and release it next week, in which across this country that started in Columbus, Ohio, we're having black men take their mask off. And if you could see the stuff that they write on their mask and write inside their mask, it would bring you to complete tears. We were in Detroit 2 weeks ago, Kenny and I, and we met with a group of brothers. Detroit's a hard place. And brothers stood up and talked about they had never experienced an event where they looked eye in eye with another black man. And some of them talked about the fear that they had the only time they ever looked in the eye in eye of a black man when it was time to fight. And so when we talk about reducing crime, when we talk about reducing violence, we have to talk about where does it all start? And it starts with mental wellness. And so if we get men mentally well, particularly black men, then we can begin to change our community. All of you all know, I started out in a community called Uzi Alley. And it was in that community that we were able to reduce crime by 80% and change that community because we were able to change the lives of the people in that community. So I just want to thank you for this opportunity to continue this work, to continue to change men's lives. Your staff came out last week. We had a graduation. I just want to share this before I end. So I brought a program you did fund, and I wanted to talk about the success, our doula program. But I also want to talk about how your work, when you fund grassroots programs, how they impact. There's a young lady here by the name of Destiny. Destiny, you still here? Yep. Come here. This is Destiny. Destiny, when she came to us, she was on public assistance. She came as a wet worker. And she got off of public assistance. She got a job. We gave her a job, and she was employed. And then, guess what? Destiny went and became a doula certified. I don't know if I'm saying that word right. Yeah. And this year, now Destiny does our, just because of the funding you gave us last year, we were able to get certified through the state of Ohio. We're the only organization certified by the state career colleges to do a doula training. Destiny now is our doula certification trainer. And Vivian and them came out last week, and they saw a lot of our women, about 17 of them, graduate from the doula training, which is very critical, particularly in black female maternal health. Destiny, tell them about your experience.
Okay. Greetings, everybody. My name is Destiny Daniels. So a little bit about me is I did come through this organization originally through the WEP program and was employed with them for 3 years. And during that time, I did get training as a doula and then left the organization for roughly 5 years and now returned with the doula program, writing the curriculum and now teaching the curriculum. And it's absolutely amazing to come full circle, leaving them to enter into birth work and then returning to help teach. With our first cohort of students, we have all of them completed the program, passed with flying colors, and have already started to attend births. So we've had a mother-daughter duo who graduated and have recently attended a successful home birth. We've had another student who has attended an induction and is actually scheduled to attend another induction later this week and a scheduled C-section the following week. So we already have one student who's on their way to getting their full certifying births. And we are already completing our second cohort of students. They are taking finals this week. And so the ball is rolling. We're making a lot of contacts within the community, and we've been in conversations with companies such as Celebrate One, Moby Nurses, to get our doulas hired and on their way to completing their certifying birth. So I'm grateful for being here. Thank you.
So I just want to thank you for the work that you do. It does make impact. It does make a difference. And so when you turn on Good Morning America in about 3 weeks and you see Real Men, Real Talk on Good Morning America, know that it started in Franklin County.
Yeah, just make sure you say that. Yeah, when you're on Good Morning America. Yeah, please, Commissioner Crowley.
Thank you for being here today, and thank you for the work that you all continue to do. Obviously, the doula space is near and dear to my heart, but also the mental health space. Some of you may know we did a talk, DEI did a talk, 2 years ago, where we were talking about mental health, and I talked about how I'm a 2-time suicide attempt survivor. First time I attempted suicide was 19. The second time was 25 after I had given birth to my twin girls, which was a very traumatic pregnancy, not understanding at that point in time I was dealing with depression, postpartum depression. I have a history of depression due to my upbringing coming up in Youngstown, having parents that struggled with addiction for 21 years of my life, and all the things that come with that. And so it wasn't until, and I would not talk about it. I would not talk about depression. I wouldn't talk about being a survivor of suicide or having 2 suicide attempts because of the stigma, because of the shame, because I didn't want to be judged, because I felt like people wouldn't understand the life that I came from and really just couldn't even empathize. And it wasn't until, and I tell this story all the time, it wasn't until I started running for office. No, before I started running for office, I was getting my signatures, collecting my signatures to get on the ballot, and that's how I met Jessica Roach. She was at Driving Park with a table letting people know about the services that they provided, and somehow I just went up and picked up a flyer, and it was talking about coming to an event, or they were having services for people who experienced traumatic pregnancies, and then she reached out and invited me to one. And in that circle, she wasn't even there. And to know me, I had only been living here not even 3 years. I'm an extreme introvert, and I wasn't going to go, and she called me to make sure that I would attend. So I went. I didn't share in that group, but what I got to do is be in community with people who had a lived experience just like I did, and make it seem like it was okay, even though I had suffered from depression, had a traumatic pregnancy, complications that were horrendous, that I wasn't alone. And then I was able to get my voice to talk about my story and to share. And so I talk about all the time how I come to this work from my own lived experience. I don't talk about things in theory, I talk about things that I know. And so that is how I got my why, and why I started running for office, talking about maternal mortality and morbidity. And in Ohio, if you are aware, when it comes to maternal mortality, the leading cause of death among pregnant women and postpartum women is mental health issues, broad. So substance use, but depression, anxiety, suicide, all of that. And this is Minority Mental Health Month, and I was getting ready to post about me being at Nationwide Children's Hospital a couple weeks ago, sitting with Charlita Tavares and Stephanie Kunze, talking about my experience trying to break the stigma, right? But also letting people know that I am in my early 40s and live a full, productive life. And me sharing my story out loud has come with, me having anxiety about that and not wanting to be judged. But also, I know that if I could save one person's life, whether it's talking about my pregnancy or talking about being a suicide attempt survivor and living a full, healthy life, then it's all worth it. I have had men come up to me and say, thank you for sharing your story. I'm from Youngstown, or, I come from a similar background, and I feel like, nobody understands, but you sharing your story lets me know that I'm not alone. I say all the time that I'm more transparent than I've ever been about my life. If you know me, I'm very guarded. But in order to do this work, I didn't want to be a hypocrite. I didn't want to talk about why we needed more investment in mental health services, whether at the state when I was there or here, from a place of not even willing to disclose myself. I just am always going to be my full authentic self. And I am appreciative for you all in providing a platform to individuals, or I like to say our neighbors, so they can be in community with one another and know that it's okay to not be okay, but it's also not okay to stay there, that that there is help, there are resources, and you are never alone. So I appreciate all that you all are doing in the doula space. That's my thing, continuing to work in the legislature and with the governor's administration to get Medicaid reimbursement for doulas. into law. I know we continue to work on that. Kevin Pangrace, our government affairs director, has been my right hand on that. Thank you for what you're doing there, because it will make a difference in the lives of women here in Franklin County and across the state, but most importantly for Black women who continue to die at almost 3 times the rate of white women, and almost 60% of those deaths are deemed to be preventable. So we have work to do, but glad that you all are a partner. Thank you.
Commissioner O'Grady?
Misters Gregory, Perry, and John, appreciate the honor. Everybody with the African American Male Wellness Walk, or Wellness Agency, I'm sorry. It was unexpected for sure. And all I can say is I was raised right. Had some great parents who taught me to recognize, the right thing to do, sometimes recognize injustice, recognize what needed to be done and do something about it, and not be afraid to do something about it. And thank my colleagues for being fantastic partners and examples of folks to work with and folks to follow their lead. And thank you guys for the work that you do and the example that you set. It's easy to do this work when you have great people to do this work with. And here in Franklin County, we have an administrative team. I have great partners. I have great examples in the community. It is easy for me to be an advocate in this community. It is easy for me to be an advocate when I have great folks in the community. I see Reverend Alshaw in the back there. I have great examples. We have great examples in all of Franklin County. And so it's easy for me to do this, and it's easy for me to do the work that I do when we have Damika Withers doing the work that she does. It's easy for me to do this when I was raised the way that I was raised. And, I was the youngest of 12 kids. I had to be a fighter, and so being a tough SOB is easy for me to be. And so this was easy for me, and so I appreciate the honor. I really do.
Yeah.
I'll close this out by, one, just taking a second to acknowledge my colleagues, Commissioner Crawley. I think it takes, first of all, one of my favorite attributes about you is your transparency and openness, for what it's worth. I think it takes a lot of courage to be that way, and I aspire to have that kind of courage like you do, and I appreciate you. And your words have more impact than you think on other people, even myself. Okay, so I just wanted to acknowledge that and thank you for your leadership. I didn't know what a doula was until you came around, so thank you for that. I really didn't. She said, "You don't know what a doula is? Let me tell you." And so it's easy to support. And so she has been our doula educator and champion for sure, among many other things here. So thank you for that. And to Commissioner O'Grady, I do want to say that he is being sincere as it comes and authentic as it comes right now. His father, Pete O'Grady, was longtime chairman of the Democratic Party when I started in politics. And every day, not every day, but once a month maybe, would take me to lunch, just a little kid from the neighborhood, and talk to me about politics and being in politics. And the conversations we had at the Levesque Tower, the press club, yeah, was, he was just taking me, and I was nobody, and I was just a kid, and I don't know what he saw in me, but he took the time to spend quite a bit of time, before I even knew you, and knew the connection. He took the time and spent a lot of time with me then, and I'll never forget that, and I do believe he's instilled those into you. The other part I say is that Commissioner O'Grady is truly a healthcare advocate. And myself, I was struggling to take blood pressure medication. And I was telling him and Commissioner Crawl about it one day. And Commissioner O'Grady, in true SOB fashion that he does, turned to me and said, "Stop being stupid. Take the damn medicine." And we were right up here. And he went on to explain his own journey and pathway. This is why we're in session here, and we're talking about it. and he was dead serious about it, and on my ASS about it, and Commissioner Crawley co-signed with him on it, and so I take blood pressure medication to this day. You know, don't like it, I absolutely hate it, but I do think often about your nudging me when I don't want to take it, or I think about relatives who are no longer with me and the difficulties they've had. And then finally, I say, Commissioner Grady, it is more meaningful in the broader case of advocacy for those who are at the bottom rung of this healthcare conversation when a white guy stands up and makes that kind of advocacy.
Yes.
And quite frankly, your advocacy probably makes a broader, bigger difference than anything I could do or Commissioner Crawley could do. So I wanted to acknowledge that. Last night, I went for a run, trying to train for this marathon, Lord have mercy, and went for a long run in the heat. And afterward, I said I can get some protein in, so I went to dinner. I went to North Star, and over in Short North, and there was nobody there. The bar was pretty empty, so I sat there, and I had a salad and a piece of fish. That's it. And at the end of the bar, I could hear there was a white couple talking, and they were just maybe 3 or 4 seats down, so I could hear their whole conversation. Not that I was listening, but I was. But their whole conversation was about the African American Wellness Agency. And they were talking about all that they've learned about screenings for black men. And the lady just kept over and over. I really felt like she wanted me to hear what she was saying, but
We're glad you did hear.
yeah, right. She just kept saying, and black men. This. She had every statistic down, and she said that she had gone to the walk. I think she said she just ran just because she was running. But she did the homework to sort of learn, and she could not believe the statistics. And she said even more so, she couldn't believe the number of people from that street screening that came out and were identified with high blood pressure, high cholesterol, whatever. And she went on and on, and the guy that was with her, he was giving feedback to say, yeah, wherever he worked, he was saying that we've been doing things specifically around it because we see the numbers too, and they had this whole conversation. And so, Commissioner O'Grady, I got to tell you, from the couple that I listened to last night to your advocacy and work, I really believe the needle is moving. It's moving slightly in the direction of our favor, but we have a ways to go, and that is the purpose of this grant. That's the purpose of the grind that you all do, whether you're in Detroit, Houston, or wherever you travel to promote this cause, because it's not enough to do it here in Franklin County, in Central Ohio, and Columbus, because that's our community, our town. It has to be a national conversation. It has to be a national strategy and approach and commitment. And I know this personally, that culturally, black families often grow up, and it's not about, my wife grew up in a very middle-class home, 2 parents, doctor's appointments, and she'll go to the doctor. She's very diligent about doctor's appointments, about screenings and different things. Me, I didn't grow up in that environment, so just culturally going to the doctor on a regular basis and not as just an emergency. When I grew up, you only went to the doctor when it was an emergency, when your hand was falling off or something, And that is a poverty-oriented mind construct, but it also, poverty is connected to racism and race. And unfortunately, all the statistics say that. It's not me just saying that. And so my point is, this, I know there are some who say, why black men? Why are we talking about black people? And there is, I don't care where you pull your statistics from, they will consistently show that not only are black men the bottom rung in a healthcare standpoint, and black women, but culturally, it is something that we have to overcome, from diet to screenings to mental health, all of these things. And I just talked to a mental health provider the other day, and they said that, I said, is it just me, or is the mental health at its height? Now, I feel everybody is stressed. I feel like a different level. And the mental health provider said 100% that it is spiking at a point to where, and to Commissioner O'Grady and Commissioner Crawley's point, mental health is healthcare. We have historically haven't had the parity from a insurance standpoint that we need to have, but the effect is very similar. You have mental health issues, and they can create physical health issues, high blood pressure, diabetes, because you might eat from, is what you're saying, you might eat from stress, you might drink from stress, you might take medication for stress. I mean, all of those things create the kind of spiral, and when you look at the unemployment rates, the housing rates, the education rates, all those things are connected that drive substance abuse, mental health, and different things, and so you have a race that's still struggling to come out from the bottom. And so I only say that because I know there are people out there who listen to us making these appropriations and whatnot and say, oh, you're just doing that because you got 2 black commissioners. That's why I want to emphasize Commissioner Grady is he understands this just as much, and that's why I shared the personal story, because it's authentic and sincere, and it's learned. It's something that he's gotten to a point where he said, we've got to address this. And Commissioner Brown was the same way. When she was here, she understood it, and so we invested in it. This is the easier part of our job, the easier decision. We have many tough decisions. This is not one of them. So
I know you said you were going to wrap up. I do want to talk about the jail real quick, because you are so much of a champion about, really addressing the disparities in our criminal justice system or in our jails that we are responsible for, and black men being there, as well as the JIC, which our youth are in. But when you talk about going into the jail, it is so necessary. And I think we are one of the leading, we lead in a lot of spaces, and I'm proud about that. But one thing that we lead in for the county, and we have 3,066 counties in this country, is one that has long-acting injectables for those who have chronic and serious pervasive mental health illnesses. But that is not enough. And if we think about who we house in our jails, is the largest population of people with mental health, right? And so the fact that you all are going, and they're black men, black men, we already know that, overrepresented 60%. And when we think about that compared to our population, it's devastating. And so we know that just treating the symptoms of mental health in our jail is not enough, or having long-acting injectables or giving them a prescription for a couple of days when they leave is not enough. We know that we need people in our jails talking to our neighbors, our residents, about what got them into, a criminal incident, right? Or what are the things that are really happening at home or in their life that had them end up coming into jail. What is it about their life that they would like to change, and really working through that with them. I know Commissioner Boyce probably saw this when he was in the State House. We both sat on the Correctional Institution Inspection Committee. I did after he served. And we would get letters all the time from people saying, you know what, I've been in prison for 3 years, or I've been in jail, sitting in jail for years, and I'm getting ready to be released, and I've never had anyone talk to me about my substance use disorder, or, well, they say my drug addiction, or my mental health. I'm scared that I'm going to relapse when I come back out. I did not get any programs or services. So I just want you to know that what you do, or what you're going to do in our jail, it's not like another program. We're talking about processes. We're talking about things that can be transformative. So these residents don't come back into our jail or come back into the JIC. We have more youth ready to be bound over from our JIC into jail or to prison than we've had before. That's saying that we have juveniles with felony convictions who are being ready to be sent over as an adult, who are probably dealing with trauma or dealing with some of the things that Commissioner Boyce saw as a child, or lost their family, or had gun violence, right? These are things that will take time to deal with, but we should not write them off. And so I appreciate you all being willing to go into our jail to talk to our residents, because most of the people in our jail have not been convicted of a crime. They are human beings having human experiences and just need a chance to turn things around.
Thanks. And I think Commissioner.
Go ahead.
Okay.
I know we've been the time is long, but I feel it necessary to make some comments. The folks with the National African American Wellness Initiative know how I feel about your work. You all, this work is important. The work you've been doing, focusing on African-American males has been important. I'm excited about the Uplift Her movement. That was quite an event you all just had. So we got to take care of all the sisters and brothers, particularly at a time when the America's Rescue is not over. In the American Rescue Act, dollars are diminishing every day. And I was just talking to the team from Job and Family Services yesterday for my fiscal update. And our PRC program dollars are dwindling, and they were looking to me for answers, and I'll be talking to you all soon about that. But the work that you all doing as a board, I feel blessed to be the county administrator for Franklin County and have the opportunity to work with you three. And Commissioner O'Grady, you one of the West Side finest. In every sense of the word, man. I've been knowing you for a long time. You one of the West Side finest. But seriously, to the point, poverty is the 4th leading cause of death in the United States of America. Just let that soak in. When we said, we say poverty is a public health crisis, and we talk about the Rise Together Poverty Blueprint. And when poverty is the 4th cause of death in the United States behind only heart disease, cancer, and smoking, that means this work is critical because people don't have access to health care, food, stable housing, and because of the issues around safety, not even opportunities for physical activity in many zip codes in America. This work is critical. We're blessed in Franklin County. This is a great county, but we got challenges, and we need community partners. And you all spoke about the community partnership program and the work that we're doing, and we can't back off from DEI. We need to have the most active Office of Diversity, Equity, and Inclusion of any county in the United States. We need to show up, show out, keep doing what we're doing, and be intentional about it, and have no shame in what we're doing, because we're doing the right thing for the people of Franklin County. So thank you, President Boyce, Commissioner O'Grady, and Commissioner Crowley, for allowing me to speak.
Commissioner Green, did you have something else?
Just briefly, Commissioner Boyce mentioned my father. And folks knew him and what an impact he had, and but his sense of justice came from, he went to law school, he was a bailiff in the court system, he was involved in politics and government, but what I learned about social justice came from my mother, my father taught me a whole lot about justice. He was he was a great man, and he was a strict individual for sure. He had to be with 12 kids. He also had a military background. But for the women in the room, in particular, my mother was such an advocate for social justice, and so that's the basis of a lot of the work that I do as a county commissioner. The work that I do as an elected leader, the work that I do as a political leader, certainly is the basis of the education of my dad. But the work that I do as a county commissioner, the work that we do together, that work all comes, and the work that I do, that I think led to this honor today, a lot of that comes from my mother. So when you talked about that, I just wanted to mention my mom based on the work, and that was mostly for the especially the women's staff in the room who I work with day in and day out. Moms and the impact of mothers on raising all of us, and the work that my wife does, and the work that we're doing raising our kids today is, I can't even imagine the impact that and the work that my wife does raising our kids, and what our kids would be like if, you know, if she wasn't impacting them because, I'm half the parent she is, so.
I don't believe that at all. Well, again, thanks for coming down today. As you can see, I mean, we don't spend this type of time in general session on any issue unless it's serious and we feel very strong about it. Most issues, we're getting through. We've done the work in the background. And so just know how much we're with you and how much we're counting on you to continue championing this work and making the progress that you're making.
Well, again, thank you. We see commissioners I'm telling you, all over this country. We sit down and talk with them, long meetings, and the first thing we talk to them about is, here's what the Franklin County commissioners are doing. Can you match them? Most of them can't. But what we do let them know is that it is the leaders of this community that has to be about the voice of change. We can't do it without you. We got to do it in partnership with you. So I just thank you all for being an exceptional group of politicians. Even amongst the state, is that when we talk to politicians amongst the state, you all still do far more better than most politicians we talk to.
We know.
And I want,
We know.
and before we leave, I do want to say to Damika, she does an unbelievable, incredible job. And she holds us very accountable and lets us know, what y'all doing, and let me know. So we appreciate the sincerity of the work that she's doing that keeps us in line.
For sure.
Yeah.
Okay, is there adoption? Is there a motion, rather?
Yeah, if there are no further comments or questions, I will move approval of Resolution 56424.
Second.
Moved and seconded voting, Commissioner O'Grady.
Yes.
Commissioner Crawley.
Yes.
Commissioner Boyce.
Yes.
Resolution number 56424 has been adopted.
Thank you.